Dr. Richard Besser, former acting director of the CDC, now president and CEO of the Robert Wood Johnson Foundation. Hi, Dr. Besser. Good morning.
Good morning.
Well, that was fast. Almost as soon as this ruling comes down, so many of the airlines that had been pushing for the mask mandate to expire lifted their requirements. Let's set aside for the moment whether or not you agree with the legal ruling. Is it safe to do so? Do you have any safety, public health concerns right now about these masks coming down?
You know, Savannah, we all want to get back to our lives as we knew them before the pandemic. And, you know, the good news is across the country, we're seeing easing of a lot of restrictions as the risk to people goes down. You know, I had hoped that the transit requirement for masks would be one of the last things that went away. And the reason for that is that there are a lot of people who don't have a choice when it comes to travel. And there are people who have disabilities, who have medical conditions that put them at greater risk, who are in situations where they are shoulder to shoulder with fellow passengers on a bus, on a train, in a subway. And if the people around them are not wearing masks, yes, people can wear their own masks, but there's some added protection when you're that close for a long period of time if those people around you also have a mask. So yeah. I would hope that people would respect those around them. And if there are people around you who are wearing masks, that you put yours on. It's not a big thing to do.
We mentioned that some of the public transit agencies around the country have differing rules. Is there a qualitative or public health difference in your mind between the safety of airline travel, airport travel versus a subway or a metro?
I think there is. You know, it's a bit counterintuitive, but actually the airflow in airplanes is much better than you'll see in other transit situations. You know, on an airplane, the greatest risk is from those people right next to you, or maybe the row in front or the row right behind you. On a subway in New York, I ride the subway a lot. You're often in a car with people very, very close to you without that same kind of airflow. When you're on a bus, a similar situation. And when you think about the people who work in those situations, they don't have a choice. So, you know, we are getting to a point in this pandemic where our lives are getting back towards normal. But I would encourage people to follow their public health recommendations, even if they're not required to by law. You know, but my biggest concern, Savannah, is that, you know, if the CDC loses its power to prevent the spread of infectious diseases between states or coming into the country, we are all at great risk. So I hope that this ruling is challenged, because in the next pandemic, the next big public health crisis, we want the CDC to be able to put in scientifically based, rational restrictions that protect people's health.
All right, Dr. Richard Besser, thank you very much. Appreciate it.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.